The hardest thing, I'm going to go quickly, is to identify the training challenges, since 50% of your procedure is done, maybe even more, by surgical assistants. Cutting, dissecting grafts and placing grafts is very important. So what I found from my own experience was that it was very difficult. Starting a practice or building a practice was difficult to find quality assistants to start with you and have enough opportunity to practice on a live tissue. So I had to identify the challenges and then to see what kind of training I can develop to expedite the training process. And throughout this presentation, you're going to learn more about the phase 1 training. The challenges was to perform. Most of the training was done on a live tissue, on a live patient, and the assistants were very nervous. They couldn't ask questions in front of the patient, and that would prolong the training process. And also, if I was training someone, I was very nervous for them to damage the tissue, and so there was a double slowing down on a learning process when we started learning on a live tissue. So uniqueness of surgical assistant, they have to have manual dexterity and physical stamina, and also mental aptitude for tedious work. What I want to talk, when I teach someone, I want to see that they are able to have critical thinking, and they have a mental stamina to think through what they're doing and stay focused for a long period of time. So the training of assistant, I kind of divided it through 2 portions, 2 phases. One is the phase 1 when we use props, and the phase 2 is on a live patient. And in phase 1, it's a shorter period of time. They're starting to build stamina, critical thinking, good hand-eye coordination, hand movement, and this period is shorter. Phase 2 takes 6 to 12 months, and the assistant will learn how to assist in surgery, to practice dissection and placement, and setting up and sterilizing. So the other task will be included in the phase 2. The phase 1 training is then divided in 2 steps. One will be practicing on a dummy. So I will use a special foam, and then I will also use a styrofoam head, and I'll explain this to you, how I prepare this. And then the second part of this would be practicing using photos. So I photographed the tissue, I expanded, and then on these photographs I explain what the follicular unit is, what this piece of tissue would look like, how to sliver, and so on. Training on a dummy, there is a foam I use, and then I can use the same principle on dissecting the foam for 10-minute evaluation of a prospect to see whether that person is capable to be a candidate for training. So if I have someone interviewing to hire as a surgical assistant, I will use cutting foam for 10 minutes and then evaluate whether this person is a candidate or not. I will have a video to show you what this looks like after this. Training on a dummy has a purpose to also teach proper body positioning. One of the important things, and what do? We create this styrofoam head as a imitation of a patient attached to the patient chair, and then the assistant will learn how to place grafts. And the proper body position is to prevent any muscle tension, but also to raise awareness that the patient, when the patient is sitting in a chair, the assistant cannot just put the elbow in the front of patient's face, or how to manipulate the patient's head. So there's a certain awareness that assistant will develop during this phase of training. We always focus on quality, whether they use microscopes or magnifying lenses, I always focus on quality before the quantity they produce. And I always teach them what is a good graft and what is a bad graft. In order for someone to know what is a good graft, they have to know what the bad is in order to make a judgment. And we focus on holding instruments correctly, then proper movement, proper body positioning, and all of this is done prior to even meeting the patient. In placing, we do the same thing. We focus on how to hold the graft. There's a gentle grip. There's importance of keeping the tissue hydrated. I introduce this concept during the training. Even though they're not working with a live tissue, I start repeating enough times that they start thinking about hydrating tissue at all time. And then we talk about correct hair curl orientation. At the end, I'll prepare a little graft and I'll show you something. You'll be able to come and see how to orient your curl. And then we also talk about mistakes in placement. What is the mistake? As I showed a graft that is transected bad versus good quality, I also show incorrect placement versus correct placement, so they know the consequences of incorrect placement, and that way I believe that they can be more responsible toward what they do. If they traumatize the graft, and I'll explain this even more in a quality control, each step